Hello everyone, my name is Hilary Limo. I work for the Ministry of Health, currently deployed as a manager, the Public Health Emergencies Operations Center. Our role is to be able to coordinate all the as a coordination hub for emergencies, whether within human or animal health. I want to discuss and be able to let everyone know about the importance of early detection. As a health worker, working with the physicians and practitioners, it's always good to be ahead of things. And the only way and the perfect way of not allowing people to be seen in the facilities in numbers is to look at the early detection space. It's about the COVID-19 case, the index case, that I would like to share and be able to connect between the surveillance system in the country and the surveillance system that we embraced from WHO Afro. The country has been prepared for many years, from 1988, to be able to look at things holistically. How do we prepare the communities? How do we prepare the health workers? How do we prepare the media and the other stakeholders who are keen and very important during emergencies? And the date that we confirmed the index case, the EOC was reactivated, full activation, bring on board all the stakeholders for us to be able to have a resilient community, be able to understand what is expected of them, be they the Ministry of Education, the learners, or the farmers, or the business people, for us to be able to cushion ourselves against spread of the COVID-19. The Ministry of Health and working with the partners pulled in resources quickly to be able to capacity build health workers, the physicians, the nurses, people working in the lab because of sample taking and sample processing. This is one way of enhancing the early detection and also giving the turnaround time for the results is very key for a clinician to be able to make a decision on what to do with a patient. And we did the mapping. We realized that we wanted to work with government hospitals, private hospitals, and also faith-based hospitals. So we brought on board, or the ministry brought on board, all the key practitioners to be able to be trained and be capacity built on how to respond to the pandemic. The only thing that we learned, and there are many things we learned, is that one, the stigma. The only way to be able to not to really work on the stigma is to carry on what we call the risk communication. Risk communication is to empower the communities by letting them know of what is expected of them, what to do when they get those signs and symptoms. And we are focusing on the COVID-19. Early presentation to the facilities, notification to the next line of call, and ensuring that all the key players, all the industries, and all the stakeholders were operating from the same space in terms of risk communication. When you empower communities, you get good results. And the outcome will be able to reduce the stigma. And once that stigma has been reduced, people are able to be very resilient and be able to work with the clinicians as expected. His Excellency the President, working closely with the Council of Governors and all the partners in this country, pooled and mobilized resources to have all our county referral hospitals equipped with state-of-the-art facilities for the quarantine and for taking care of patients, and also to ensure that all our lab facilities within those subnational level were well equipped with all the requirements, the reagents required, and be able to have a system of ensuring that movement of samples from point A to the next point was done in a way that it was meeting the global requirements. And we realized that the country, within a short time, working with all the stakeholders, was able to put up these facilities that are now being used for other, within those, for other care expected in those facilities. Again, in terms of the ambulances, the ambulatory services, that's part of the care, because this was very key to ensure that patients were moved to specialized facilities within the shortest time to save life. The ministry for a long time has been focusing on immunizing children under 5. So we've had a very good system of immunization in the country in all our facilities, whether you are in government facility, private or faith-based. And when we got the challenge of deploying COVID-19 vaccines, we were not starting from scratch. We were building on what already existed, and we utilized the already trained staff to really be able to take care of a wider population. Instead of children below 5, now we are focusing on the entire population as when required. We have the infrastructure because I want to connect the training of the health workers at that time, and also the facilities to store this vaccine, the fridges that are available in more than 8,000 facilities in this country. We deployed again quality and equipments that were procured within a short time to give additional space for storage of these vaccines. And this was done in a record time to ensure that whatever we gave out was a vaccine, potent vaccine to save life. And we were able to give real-time certificates to the people who were traveling out of the country, people who were coming into the country. They were required to be vaccinated at the point of entry if they had not been vaccinated from their country of origin, and this worked well for us. So like any other new vaccine, we've gone through a lot of processes. Anytime before we introduce a new vaccine in this country, we ensure that we bring in experts, risk communication experts, to tell the people of this country about the new vaccine, the advantages, and maybe if there are side effects. It has been an open way of doing this. And when it came to time of deploying the COVID-19 vaccine, we brought on board not only the experts, but even faith-based, the Christians, the Hindus, the Muslims, people of faith, to be able to tell the world about the benefits of COVID-19 vaccine. This was meant to dispel the myths and misconceptions as to why we were introducing for the first time the COVID-19 vaccines to a wider population. And by bringing on board all these stakeholders, especially the faith-based, it gave us a platform not only to succeed in deploying the vaccine, but again to really empower the communities to appreciate the benefits of utilizing the vaccines available to children and adults. A member state to WHO, the World Health Assembly. And part of us working as member states under the umbrella of WHO is data sharing. We do this data sharing to ensure that we have information being shared to one central point. And during the COVID-19, we were under obligation as a member state to WHO to share data. And I wish to confirm that this country on a daily basis was sharing data not only to the Kenyan people, but to WHO and other partners as expected of us as a member state. There are benefits of sharing data. When you share data, you get the best support from people within and without. Two, you are able to look at things retrospectively. In terms of epidemiology, data sharing is key. You are able to learn to know how and where and when and how to respond. So this country, through the Ministry of Health, we've been very consistent, and we will go forward again by working closely with the WHO and any other stakeholder in terms of data sharing. We are cognizant of the Data Protection Act, so we know what to share and not what to share. So we are very keen, and we work closely with all people within the country to ensure that we protect the patients. We are able to ensure that the data we share does not have the biodata that be able to expose the individual patient, but we have only what is relevant for the country to make a decision in terms of control or prevention. We know very well as a country that we don't have adequate members of staff to support the healthcare system in the country. So through the efforts of the president, we have a good number of community health promoters. These are very key because it's a link between the communities and our facilities. And during the COVID-19, we were able to deploy and use the community health promoters to do the contact tracing, that's one, to ensure that the cases that are seen within the community were reported promptly. And we saw a very good collaboration between those two critical points of government and the layer that we request, especially when it comes to level one of the care, that is the community and the dispensaries. So, and again, when it comes to the follow-up of these patients during that period of the COVID-19, the community health promoters were able to work closely with the other arms of government, especially the Ministry of Interior and other agencies that were supporting the response during that period of the pandemic. So the system is working well, and right now, as we speak, they are going out of their way to ensure that there is linkages between the communities and the level of care. So as a Kenyan and as a manager of the EOC, what's my take about the COVID-19 pandemic? One, I was able to pick several things, but I'll only mention few. One was the way the whole country was able to come together as a team, starting from the presidency to the cabinet, to the parliament, judiciary, and have one voice. This was the best thing for us because we realized it's one government. The same government we talk about, Kenya plus 254. We were able to empower the communities, and by empowering the communities, that is what we call the building of the resilience. And a resilient community is very important for one reason. Outbreaks or diseases begin at the communities and end at the community. So I'm happy to say that we are part of the process because our communities, wherever they are, were able to end the pandemic by adhering to the requirements from government. The other thing that I want to really echo and I'm proud of as a Kenyan and a health worker is when I saw people from the private sector, from the academia and other spaces coming in to support and complement the efforts of the government. The media came in not to criticize, but the media came in to support and share information as required of them. And we've seen a very good collaboration between the mainstream media houses and the social media to empower the communities not only during the outbreaks or the pandemics, but to have ways of early detection, be able to come in and be able to share information to the country and to the region. We belong to Afro region as a WHO regional office, but we realized also we needed to work with other regional offices. We needed to work with all the other agencies outside the country, and we got an opportunity. And I'll name a few. When you look at maybe financial institutions like the bank, they came in strongly to pull the resources through the chairmanship of that level and come in to pull and give government a lot of support. In conclusion, I think I'm a very happy person to report that COVID-19 gave us a platform to work as a nation. We worked well, and going forward, we need to learn from that. We've had a lot of good experience. In the level of care in the facilities now, we know what to do. Fear is not part of us. We'll be able to address any challenge as it comes as a nation. And we look forward to a very resilient community, and we will work closely with the learners. Specifically, I'm touching about the learners, because when you look at the population of this country, we have a good number of learners, and if we empower them to be resilient, we'll be able to sustain. Simple thing that we worked about on the washing of our hands, and it did a lot of wonders. Children are good avenues of disseminating information to us parents and any other person older than them. So with this, we as a country, I think we are happy that we were able to respond, and we look forward to any challenge moving forward as a country. Thank you.